spotlight on to Dr. Oliver, our VP Clinical. He will be unveiling key insights from our latest report titled ASEAN Workplace, Key Insights from Our Regional Research, and that will examine workplace well-being and trends across 10 ASEAN countries. I think there'll be some polls for this session, so get ready your mobile phones as well, so it's going to be more interactive. And again, of course, if you have questions, feel free to leave it there, and we will be able to address them later on. All right, so Dr. Oliver, over to you.
Okay, good morning, everyone. It's great to see so many of you. Let me start with a confession. So we have many of our wonderful colleagues from overseas here, and Theo asked me last night, oh, do you want to join us for dinner? And I felt so bad. I said no, because I wanted to have an early night, and also my kids are a bit sickly, so I didn't join for dinner. And now I had a terrible night. I hardly slept because we've got 2 daughters, 2 and 4, and the 4-year-old one was coughing through the night. So I've got dark eye rings. I may not be as sharp, so bear with me. I'll do my very best to walk you through the session, just to put it out there. Another quick personal sharing before we start. So Intellect really started more than 5 years ago, and I met Theo in 2019. And I was an advisor from day one, so I really journeyed along the way. And one of the things that really convinced me to be involved with Intellect and to join full-time later was Theo's personal sharing, because I could relate to it. I have my own personal struggles that I was seeing a therapist in the past as well. But more importantly, which is what this session is about, we were committed to the scientific sort of proof and validation of what we do from day one. And that was sort of my condition to join as well. So from day one, we have heavily invested into the research. I also look after the clinical quality and governance, but today I'm wearing the research hat. And I'm very excited and very proud as well to share with you some of the latest research we have been doing. Now, it is very easy for anybody or for any vendor to claim that what you do works. It's a lot harder to actually prove that. So what we do at Intellect, we conduct studies in partnership with our friends and partners at NUS, at Duke NUS, and we really heavily scrutinize our efficacy. We publish in peer-reviewed papers. That's a bit geeky, but what it actually means is we have external, independent professors scrutinize our research. And it's very difficult. It's painstakingly long, and I know I tested Theo's patience a little bit at the early days because it takes a long time to get your work published. And we're very proud that we have more than 6 papers now out there. You're very welcome to read it. We have done a lot of studies on efficacy, on RI, the so-called business case. Now, today's session is not about that, even though if you're interested, please talk to me afterwards. You could actually flip it around. You could say, what's, in the words of my friend Shalaja, somewhere, she's here, yes. I had a good conversation with her and we flipped it around. What's the business case for not investing in mental health, right? Okay, but without further ado, let's dive into our ASEAN research. If we can click to the next slide. So what we've done is we did a large-scale study, close to 600 HR professionals we surveyed across ASEAN, both the public sector, the private sector, from all industries. And we were interested in well-being gaps organizations have in their solution. We were interested in stigma, awareness, and we wanted to inform both policy change and also make recommendations for best practice. Now, I can only really give you a snippet of what we've done. There is a QR code later, but I was just told it doesn't work, so please come to the booth later if you want to get the white paper. Okay. Okay, now I have to say, I haven't done this by myself. In actual fact, I'm really only standing on the shoulders of great people, my research team, and also our collaborators. So a huge shout out to Sherlyn, she's somewhere here, who's the brain behind this, and did a lot of the legwork, Sichi as well, and of course, Dr. Bob Aubrey, who's a friend and our collaborator as well. Also share that we were invited to share preliminary findings in the ASEAN Secretariat in Jakarta last October. This is how long the study's been going. And hopefully you heard Dr. Bob share that we continue to work with the ASEAN governments to implement such as these mental health policy changes, and we were invited to continue this effort with them. Okay, next slide. This is an overview of the methodology. High level, we did a survey of close to 600 HR professionals. We did qualitative interviews with key stakeholders, and we did a literature review. I say we, mostly Sherlyn and some of the help we had, but we deep dived as well into well-being in ASEAN. So it's quite a substantial piece. The findings I'm sharing today are for the private sector. Bear with us, in a few months we'll have the public sector data published separately because we thought that makes sense. Okay, next slide. Now, I thought I'll start with a bit of history. Perhaps some of you have come across Aristoteles in school. I thought it was very relevant. I don't know, many of you probably don't know, I have Greek roots as well, so I thought I'm very fond of Greek philosophers. But more importantly, Aristoteles came up with a concept of eudaimonia, I hope I pronounced this correctly, which often is wrongly translated into happiness. Happiness is more a transitory state that passes very quickly, which is heavily rewarded in our capitalist society. Of course, we chase money and fame and so on. But what Aristoteles meant is actually a concept of flourishing, connecting with your values, a purposeful, a meaningful life. And of course, you can see the relevance for the workplace because we spend so much time at work. So it's highly relevant. And it's a lot more, there's a whole lecture on its own, but we'll leave that for another session. Next slide. This is the definition from the World Health Organizations, and you can see it's actually quite similar. So mental health refers to a state of well-being during which the employee or the person, they can realize their potential, they can cope with normal stresses. I say normal stresses because life can be horrible. We have bereavements, we have losses, we have life transitions, we already heard that. So the emphasis should be on normal. And to learn well, to work well, and to contribute to society. Now, well-being is extending this concept by including quality of life, and we'll touch later on, there's an aspect, financial well-being, social well-being, physical well-being, and so on. And importantly also meaning. And so when we talk about workplace solutions and well-being, we don't mean isolated interventions that only target one of them. These need to be coordinated efforts to target all these different aspects to help our workers to thrive. I'll speak to some of those points later on when we look at the findings. Next slide. To make this a little bit interactive, I have two questions for you, and then we contrast your responses with the findings from the white paper. So take a moment and help me just pop down the question. Do you hire people in your organization with mental illness or mental health conditions? Okay, let's have a look at the results. Okay, very interesting. It's actually quite similar to what we found. So about half of you are hiring in your organization people with mental health conditions, and you are applauded for this. This is wonderful. Some of you are saying no, although that's a minority, and hopefully we can get that number smaller with time. But interestingly, many of you are also saying not sure. And there is a reason for that. We'll come to that, and that's to do with our confidentiality and hiring practices here in Singapore. The Tripartite Alliance for Fair and Progressive Employment Practices plays a role here. Okay, next slide. No, the other way. Okay. So these are the findings from our study. So if you, green is yes, if you look at the green bar, Singapore is in the on the lower ranks here. So we asked the same question, do you hire people with mental health conditions? Many of them were not sure, but surprisingly also many said also no. Okay, so next slide please. So then we looked at it in a bit more depth. We wanted to understand the reasons for that, and there's multiple reasons, but they're quickly summarized. One is still stigma plays a huge role, both from employees, one, two, from hiring managers and management, not being willing or not knowing how to adjust the workplace to support people with mental challenges. But the largest bar, and if you look at, Singapore is about a quarter, say there are there's a lack of awareness, or there's possibly a lack of interest in mental health still. And that's despite our national efforts. We heard Eric Chua share earlier, and PM's effort as well. So there's still a long way to go. But yeah, I just mentioned the confidentiality and non-disclosure practices. Now, in Singapore, as you probably all know, you're not required to disclose that you have a mental health condition unless it's really critically relevant, say Army, Air Force, for example, then you need to do that. Otherwise, not an MOM can actually investigate. We will have legislation come into effect in a few weeks, so then it'll be in law as well. And there's also a lack of resources, which was another finding we found. So next slide, please. Here are some recommendations, and this is not an exhaustive list by all means. Project Hire is something I highly encourage you. NCSS, they have wonderful toolkits and advice. They help to get employees ready for work when they struggle. They support managers as well. Lots of free resources. Do check it out. Now, you heard Theo and others and Cass earlier share about mental health first aid. That is a wonderful, very practice-focused mental health first aid training, which is globally the most renowned, most research-backed. Eric himself trained, and it's a great way to upskill your hiring managers as well, so they are more aware of mental health challenges. And they're the ones later on being the line managers as well. And we all know the relevance, the importance managers have for the well-being, the psychological safety of their teams. I'm very, very proud to say that in Singapore, we are the sole licensee to offer this training. And then lastly, we also at Intellect, we have an org consultancy team under Alicia, and we have a very structured, systemic way to consult with organizations as well, which takes a multi-level approach. So we're looking at interventions for the individual, for managers, and also system-level culture change. We heard from Antia earlier as well. Change comes from the top. You need to have leadership buy-in. Otherwise, no one's going to use your no one's going to use your resources. On a side note, I don't have a slide on this, but we also, you'll see this in the white paper, we asked HRs, do you communicate about your resources? And 95% said yes, they do. Town halls, newsletters, email blast. But less than half, if I recall this correctly, actually use it. So there is a real disconnect, even though organizations communicate about the resources they have for mental health, people are not really using it. So there can't really be a lack of resource awareness. It's probably to do with psychological safety, I'm guessing. Maybe other reasons, but something to be aware of. Okay, next slide. Next question. I'd like to hear from you what solution you have in place in your organization to support the mental well-being and health of your employees. And you can give multiple answers. This covers the whole spectrum of mental health, really, including crisis care, helpline, mental health personnel, counselors, coaches, therapists, but importantly also digital mental health. We heard Prasad earlier share as well about technology, and that's certainly very relevant when you want to scale and make your resources accessible. So interesting distribution. I'm a little bit surprised to see that very few of you put crisis support, because I thought that is the bare minimum we should have in place for people who struggle with mental health, right? Okay, let's see what we found in the study, how that compares. Okay, so crisis support, just to pick this, actually fared a lot higher. So this is obviously, these are averages across countries. You can see the breakdown in the paper, but about in Singapore, about 40% of the organization we surveyed have crisis support. 70% said they have a helpline in place. That's wonderful, because even though utilization of those is low, there are times of crisis where we absolutely need it, and we've all been to very dark places, and that's why a helpline is a very important tool or a very important piece in that solution you should have. Digital mental health support, 40% in Singapore, 42% in mental health personnel. Okay, and yeah, this is the slide from the study as well. So Singapore, we found that most organizations have at least one of the options I just showed you, but a long way to go to really have a comprehensive, supportive system in place that covers the whole spectrum of mental health care. Okay, not to hard sell, but I want to quickly share with you how we build our mental health care system in Intellect. So Theo earlier shared as well, right? We do really recognize by now that mental health is on a spectrum and we're all there somewhere, and we move along as our life circumstances change, as our work changes, and so on. So crisis need, 24/7 localized helpline, super important. Cultural awareness is really critical. You want to have a helpline not outsourced to a third country. You want to have it in the country the workers are in, so they feel understood. You want crisis support when things go really bad. Just a week ago or so, we had an employee, one of the clients we work with, commit suicide, and we needed to react very fast. And sometimes same-day deployment is critical to support the individuals, the teams, the managers. But granted, we're really only talking about maximum 5%, I'd say here. The vast majority of us are somewhere in the middle. The orange, the yellow section. We struggle with burnout. I just shared with you, I didn't sleep very well. Everyday emotional needs. We may have, difficulties with our spouses and so on. So we benefit not from crisis care, but from other more proactive, preventative care solutions, such as coaching, which is a bit more bite-sized. It's shorter. You work with a professional on either work-related topics, for example, work stress, how to give feedback. When you're just being promoted, you're having certain challenges, but also everyday emotional needs. You might feel particularly angry. Also how to build confidence, to stand up for your right, and so on. We have a huge library of self-care programs now, and this is where a lot of our research has been conducted, especially in the early days. We've done a lot of randomized control trials that beyond doubt prove that our self-care is very, very proactive, preventative of things like OCD, anxiety, worry, stress. We have things on body image, self-compassion, and so on. And I mentioned earlier, the holistic well-being is super critical as well. You want to have something on nutrition, physical well-being, financial well-being, legal support. Okay, next slide. Actually, one slide back. Rush that. And we have conducted the research I mentioned earlier on all those pillars. Now, I'm very excited now, hot off the press, even Theo or my other leadership colleagues, or anyone has seen the next slide. So we have a strong research team. We crunch a lot of data. And I'll be sharing with you now some of the coaching data we have and how it actually helps in a very, very preventative way. Next slide. Okay. So we looked at 70K data points, and we trimmed it down to, I think, about 2K, where we have pre-baseline data and then employees attend coaching sessions. And I'd like your attention on the left-hand side first. So the green bar, these are employees who took up coaching, and the PHQ-4 is a measure for mood and anxiety. And we can see that employees are higher on the PHQ-4, so they struggle more, so it makes sense. They take up coaching. And we see a significant drop after about 3 sessions or 4 sessions. That's the critical point usually, where you start seeing improvements. Whereas there's no change in those who don't take up coaching. We're definitely going to publish this in a very strong journal. I'm super, super excited about this. One of my NUS students helped with this, Chloe. Kudos to her. Very quick, emotion regulation as well. Coaching improves emotion regulation. And self-awareness, Prasad touched on this earlier as well, is so critical that we understand our own emotions. We had the activity with Jit and Julia just now as well. And clearly, those findings show that self-awareness is also improved following coaching. Okay, next slide. I think we're almost at the end. Now, I want to also not just show to you what we do at Intellect and how we think we do things better than others, but we're also looking at, evidence-based protocols. So the World Health Organizations has a lot of resources for workplace mental health, and we're very closely aligned with the WHO guidelines, which, very quick, high level. At the organization level, this is where culture change happens, and you're looking at things like flexible working hours. At the manager level, we spoke a lot about it. That's where the mental health first aid training comes in quite powerfully to build mental health literacy, but of course it's for workers also. We heard Eric share earlier about the well-being ambassadors in the government, which is a really, really important movement as well. ground-up awareness. Individual interventions, make sure that what you offer is evidence-based, such as CBT. And then very importantly, Theo also touched briefly on this, return-to-work programs are really critical now as well. And I'm very excited to also share that we have created that at Intellect as well, because we recognize that people returning to work, just like from physical illness, when they return to work from mental illness, there's certain considerations. Perhaps you need to change the job scope. Perhaps you need to continue with coaching or counseling while they reintegrate. Perhaps you need to work with a manager. So you need to be a little bit structured about it. Okay, I think we're more or less done. Yeah, so this is my final slide. I didn't touch on all those points. Please go to our booth. You can also go to the website, I believe, in due course to download the white paper. We touched on the importance of inclusive hiring, on expanding your interventions, not just to look at crisis care, but coaching, as I shared, is a really powerful way to empower your employees to work proactively on their mental health. So to be proactive, not reactive, but not forget about the crisis care. You want to equip leaders, and very importantly, the communication piece is really critical as well. I shared with you, while most organizations in our study, they communicate to their workers about the resources, but it's not really taken up. So you probably, my guess is, you probably want the C-suite to embrace it. As Antia shared, change comes from the top. You want, as we heard earlier, Jeffrey Heener as well share, you want vulnerable leaders, walk the talk, because then employees feel safe enough to also take up, help when they need it. With that said, thank you so much for your attention, and I'm happy to continue the conversation with you. I think we have time for maybe a couple of questions.
Unfortunately not.
Okay.
Because we still have a whole lineup. So thank you, Oliver. But I know for a fact Oliver is going to stay here until the end of the day, not at the end of the festival. So if you have any questions, please feel free to reach out to Oliver. And he'll be happy to take them. Thank you, Oliver.